Today we're going to talk about asthma and its connections to the microbiome. And I'm Dr. Martin Rutherford. I am a chiropractor and certified functional medicine practitioner.
Dr. Randall Gates, board-certified chiropractic neurologist, also a chiropractor.
I think it's should be a popular topic simply because it seems to be a lot of people who have asthma.
Mm-hmm.
And we again, for those of you who may not have watched us, we've combined the disciplines of functional medicine and functional neurology to create a paradigm and an algorithm that has been fairly successful in treating a lot of chronic conditions, a lot of chronic pain syndromes, a lot of chronic neurological syndromes, a lot of chronic syndromes that like asthma and IBS and fibro and things of that nature. And so what we do is we just sit here and share with you basically what we've seen in practice, what we've seen work, what we've seen not work. Dr. Gates has done an enormous amount of research, and we kind of set our wagon on four wheels of other people who had done enormous amounts of research. Your mentor, Dr. Carrick, my mentor, Dr. Karazian, just people. So what we talk about generally has a number of peer-reviewed journal references attached to them if you look at powerhealthtalk.com. So we're just sharing with you what's going on. And asthma we see all the time, but it's another one of those conditions that people don't come in with. Mm-hmm. Nobody comes in here for asthma. I don't remember anybody ever coming in here for asthma. That might be, maybe there's one or two people that's ever come in, but most people come in, I have fibromyalgia, I have asthma. We had a little young lady yesterday who came in, and she's here for fatigue and weight loss, unexplained weight loss. She had asthma. And so that's how we see asthma. And we also see a lot of these conditions in a different way. We see everything is connected. When people come in and when you start taking that patient's history from the time they started to get sick, whether that's at birth or whether it's at 12 or whether it's at 16, you start to see a connection between all of the different entities that go on. And asthma seems to be one of those that will frequently disappear while you're treating everything else that the patient came in for. So I think this will be really, and if you've watched anything, or if you watched a lot of our presentations, as many of you have, you'll know we talk a lot about the microbiome. And so what we're going to do is review asthma, what it is, how it affects your lungs, and then connect it to the types of things that we've seen relative to research in the gut. So asthma is inflammation of the alveoli.
Well, inflammation of the respiratory system, and in essence, can lead to decreased basically inspiration, mainly expiration. That's where patients have a lot of trouble. They may feel like it's inspiration particularly, but expiration can be decreased as well. That's how they measure forced expiratory volume. That's where you breathe into the thing, you go really hard, and they see how much you can expel. And that's one test for asthma. And yeah, asthma can be a disabling or life-threatening condition without a doubt. And it affects a lot of individuals in Western society. And the number of asthmatics is just growing. And that's what they're discussing throughout the literature. Why is this happening? Why are so many of these diseases basically becoming epidemics, if you will? I know asthma is not an epidemic, but many others that we do talk about are on that order. And basically all of them seem to be increasing in prevalence, these quote unquote chronic industrialized society conditions.
And historically it's treated with
inhalers, corticosteroids, usually they're all these different routes now, these different high-level medications, singular, things of that nature.
And there's so different kinds, like in a sense that they'll call one athletic asthma that's in the kids that seems to disappear a lot as they grow up.
They outgrow it.
And maybe you want to touch on that as it goes, because that's one, we see that one a lot. And then there's the standard asthma and with the bronchodilators and those types of things. And so
basically a lot of these inhalers either bronchodilate, or they are leukotriene inhibitors, so there can be inflammation in the lungs, and so these medications help to shut off these inflammatory pathways in the lungs, kind of like Celebrex is used for arthritis or used to be used that way. That's a similar type of pathway as to some of the medications that are used for asthma.
So you mentioned something that I didn't realize before we came on, and you mentioned that asthma is kind of a Western disease. It's not a disease that is all over the world.
Right. It can be in different areas of the world, in third world countries, but it's much less common than it is here.
Okay.
It's so much more common in the United States and other Western societies, and the researchers are trying to figure out why. And they're looking at not only asthma, but other allergic, and as they term them, atopic diseases. So you can classify allergic rhinitis into that, so hay fever, or eczema, or chronic rhinosinusitis, which is those people with chronic sinus infections. And what they're seeing is that the connection seems to be with microbial diversity starting in the gut and expanding out to other places in the body. Now,
for those people who might not know what microbial diversity
so
is.
We're going to go into that. So we'll kind of talk about that relative to the gut.
Okay.
So your gastrointestinal tract has normal flora. Many of you may have heard of that. The normal flora help us to basically have a normal environment in the intestines. And when that gets disturbed, then abnormal bacteria can start to grow, or yeast, or different organisms, and they can become problematic. Now, one of the classic examples of this is in the elderly population. If someone who is in a nursing home, for example, takes an antibiotic, they can have a bacteria called C. diff, Clostridium difficile, that will start to overgrow in their colon, and that can result in diarrhea upwards of 10 times a day. It can be life-threatening. So that's a good example of how when this normal flora or microbiome is disturbed, that we can have a disease that ensues. Now, in the 2000s, and it really gained traction in 2010, I'll say, to 2014, a lot of research started coming out showing that the microbiome, or the microbial diversity of the gastrointestinal tract, was different in patients who had obesity versus those who didn't have obesity. And then that tied in also to those with diabetes type 2 and those who don't have diabetes. So we had this explosion of research where doctors and the gastroenterology were really trying to figure out what was going on, and they have concluded that we do have these stark differences, and now we're seeing this parlay into many other conditions. And we're seeing a gut connection to conditions as far-reaching seemingly as rheumatoid arthritis, or multiple sclerosis has a gut component. Diabetes type 1 has a gut component. We're seeing food components with thyroid disease. So we have this new but exploding area of research. And so from that, Dr. Rutherford and I did a broadcast maybe a month ago or so, on eczema in the gut. And so in those journals, and these all come from allergy journals and dermatology journals, where they're talking about how patients with eczema, which have basically skin lesions that aren't dermatitis herpetiformis, or they're not psoriasis, or they're not seborrheic dermatitis, but they're just basically an unknown type of rash, seem to have correlations to altered microbial diversity in the gastrointestinal tract. So it's very interesting. And then somebody requested today that we talk about asthma, and that's what we're doing. And so we pulled up the new literature on asthma.
By the way, I immediately developed eczema after that.
I know, interesting, right?
A little case. I have a few autoimmune problems, for those of you who've never watched before.
And so we started looking into the literature on asthma, and what they're finding, the prevailing thought used to be that the lungs didn't have any bacteria in them, that this was basically, unless you had pneumonia, this was a kind of a pristine environment, so to speak, a very clean environment. And now we're finding that that's not necessarily the case. We have new ways to amplify and figure out what bacteria in different areas of the body, separate from just culturing them out. And they're finding that all of us do have bacteria in our lungs, but those with asthma have different bacteria again in their lungs than those who don't have asthma. The same thing has been found for those who have chronic sinusitis, which may not be as big of a surprise, but those people who get sinus infections all the time, they have different bacteria in their sinus cavity than those who don't get sinus infections. So it's a very, very interesting topic, and basically the current literature pertaining to asthma is relating back to the gut. That's where the researchers in allergy and asthma are going back to explain why someone with asthma has different bacteria in their lungs than someone who doesn't. Now, a lot of the research is talking about how you come into this world. So cesarean section, which Dr. Rutherford talks about a lot, versus non-cesarean section.
So you don't get the...
And so if you come out that way, you're not getting the meconium from the mother into the lungs.
So you're not getting...
We want a lot, but you're not getting that into the oral cavity that may spread to basically populate the lungs.
When you come out, for those of you, when you come out, you're facing your mom's anus, your rectum, and then you get that bacteria in there, and then it kind of plants her in your intestines, and then it gives you her immunity to your mom, and it gives you good bacteria for your gut.
Especially later in life.
That's what he was talking about.
Yeah, and
for a few of you out there that
might go a little bit on a tangent there, relative to the obesity world, what they've shown is that children who have obesity, they're getting their obesogenic bacteria from their mother.
Yeah,
which is no surprise.
Yeah.
Now, then we have the whole question of the first year of life, and the first year of life in our development is very interesting, and that's really changing, and that's one of the things that's really being talked about in the autoimmune world, is that we're quote unquote too clean. And I was just talking to a gentleman yesterday who was a world-class sprinter, actually, and he grew up in the Caribbean, and he was telling me about his upbringing, and they didn't have TV, and a lot of people lived in a small little house, and they stayed outside, and basically, and this guy is as healthy as a human being possibly can be on many levels. But it was very interesting just to get his take on what his upbringing was like, because you contrast that to the way so many kids are being brought up today. We have a lot of moms who are germaphobes. They're afraid of germs, and the kids getting exposed to anything, when in actuality, the current immunology research, and I'm not telling you to purposely expose your kid to some harmful pathogen, but the literature is showing that these exposures earlier in life can be a really positive thing. In fact, a famous immunologist wrote a book, I believe it was titled Eat Dirt, Dana Rubush. And because and of course, if you eat dirt, you can get infantile botulism. We're not encouraging that, so always got to be careful. But the point is that maybe we're too clean as a society, and we're coming out via cesarean section, and then we're getting infections, and we're placed on antibiotics. That's another thing that's specifically talked about in the allergy and asthma world, early in life, which decreases microbial diversity, can lead to other harmful pathogens. Maybe not immediate pathogens, but chronic pathogens that can develop in the respiratory, sinus, and gastrointestinal areas. And then that promotes systemic and chronic inflammation, that then people develop these diseases many years later. And that seems to be kind of what's happening now in asthma. So it is exciting.
This is very representative of how we've come to our conclusions, or how your research, and I say his research because he does all research now, period, and how your research has been directed. Because in the beginning, just from the very beginning, once we figured out to do the person's gut first, and we started seeing all kinds of things happen that were positive in that person's health, we started seeing asthma go away. I assumed, before this understanding of the bacteria, I assumed it was that we were decreasing inflammation and decreasing immune responses. Stress hormones can damage the inside of the lung cavity. So I thought, well, we got stress hormones, because putting these two disciplines together, Dr. Gates's techniques, and we're calming down those stress hormones, calming down the flooding of the system with stress hormones, and then using the functional medicine was calming down the gut, calming down inflammation, calming down immune responses. And then, and then we find out that bacteria getting out of the gut, but I still didn't make that connection. It was still like, okay, they're getting better, and this is what we're doing. And then to understand now that they have unique bacteria, and they're finding this in everything. This is how it was determined, was last year or year before, that rheumatoid arthritis is coming from the intestines. They found a certain bacteria in the joints of rheumatoid arthritis patients that was thought to be only supposed to be in the gut. And now they're probably going to make a similar connection to the lungs.
Yeah,
or they have
a
made
chance it. Or, is this microbial diversity just because of, like we talked about the meconium or lack thereof. Many of you may be screaming, I wasn't born via C-section. Well, maybe it's what Dr. Rutherford's talking about. Exactly. Maybe that's the new frontier.
Right.
Because that's what a lot of people are seeing now. It's very interesting because we are seeing microbial translocation from the gut to other parts of the body without a septic response. So medically, people will know that if you get bacteria in your bloodstream, it's called sepsis. But we attach new literature to our Alzheimer's broadcast showing that there are these kind of quiescent. So that means bacteria that aren't causing a problem floating around in the bloodstream, going to other areas of the body from the gut that shouldn't be there in the bloodstream. And that's creating inflammatory pathways associated with Alzheimer's. And you highlight on RA. So it's a very, very interesting.
Same thing we've seen with sinusitis. I mean,
that?
to the point of where someone comes in if they've had chronic sinusitis, and again, that's one of these things. People come in with fibro, or they come in with something else, chronic fatigue, and they have that. Usually, I'll indicate it appears to have something with the gut, maybe liver, gallbladder not cleansed, but it just seems to be intestines, and sure enough, the research ultimately bears out what we've seen in clinical trials, and then that'll allow you to fine tune more. When you're working with a sinus or asthmatic patient, it gives you one more tool now in your toolbox to say, okay, I know it could be bacterial, so maybe we'll do this or maybe we'll do that. It's pretty cool.
It's very cool.
It's pretty cool.
In fact, and I just want to read you this quote. This is from a journal about microbial diversity. And they said, data suggests that the airway and or the gut microbiome may represent fertile targets for prevention or management of allergic asthma and other diseases in which adaptive immune dysfunction is a prominent feature.
Okay.
So, we attach references. So if you want to access these references, go to powerhealthtalk.com. And before we conclude, we want to highlight on the exercise-induced asthma component. And so with that, one of the thought processes are with exercise-induced asthma is potentially why does somebody basically grow out of it? And one theory is that it's a nervous system issue where you can get sensitization of these. You basically have like pain receptors in your lungs, but they're not sensing pain, they're sensing inflammation. And that as you grow up, your brain and your spinal cord's ability to dampen out those nerve signals improve. So that's one thought process. I attached a journal reference. I think I attached it, or maybe I just sent it to my email, where they're also talking about the high level of anxiety associated with chronic asthma and dyspnea. And so, as many of you know, you have anxiety, when are you going to have an asthma attack? And that can actually create a reciprocal relationship in your brain where your brain becomes more anxious, and that can further promote the dyspnea process.
Yeah, the young lady yesterday was a perfect example. She actually, her asthma is better. They had diagnosed her with it. She's 11 years old. Went to a very well-known, not want to diss anybody, a very, very well-known facility here on the West Coast, and got a couple of standard diagnoses. And her mom decided, I'm going to look this up and I'm going to change her diet and I'm going to take her off of a number of foods. One of them was gluten, and her asthma went away. So she has her brother's got celiac. She's tested normal for it, but it was a blood test, which is not the most accurate way to go about it. So maybe she's got celiac. She comes down the immune response. She heals the gut. Either the immune system gets better, or the gut or the bacteria get better, and her asthma gets better. And that was after going to one of the most prominent, if not the most prominent medical facility on the West Coast. So Hippocrates said in 500 BC, look to the gut for the cause of all sickness and disease. So at least for sure, look to the gut for the cause of asthma.
Exactly.
Yeah.
That's where it's going. So we appreciate you watching. We can't take personal questions through our powerhealthtalk.com, but if you have any comments on other broadcasts you want us to discuss, let us know there. Again, you can access those journal references if you just search asthma in the search tab on powerhealthtalk.com, and just scroll down below this video and you'll see all the references. So we appreciate you watching, and we will see you next week.
Bye.